Hello, this is video number 1, and I'll be discussing the anatomy of the respiratory system. And on the outline that's posted on Canvas, we'll be talking about, first of all, a general overview of the respiratory system. And then we'll go down through the different parts of the anatomy. So it's broken down in terms of regions that are conducting air in or out of the body. So that's called the conducting zone. And that's further broken down into structures in the upper respiratory tract. So those include the nose and nasal cavity, the sinuses, and the pharynx. And then secondly, structures in the lower respiratory tract, including the larynx, the trachea, and various tubes contained within the lungs, bronchi and bronchioles. And then eventually that leads to structures that are involved in gas exchange. Those are called the respiratory zone structures. So those include a respiratory bronchiole, alveolar ducts, and alveoli. And finally, the respiratory membrane, which is the actual site of gas exchange. Future videos will focus on the details of the respiratory membrane and on the gross anatomy of the lungs and on the physiology of the respiratory system, which is broken down on the outline. So let's start by looking at the structural and functional organization of the respiratory system. And as I mentioned previously, the upper respiratory tract shown here includes the nasal cavity, the sinuses surrounding the nasal cavity, and the pharynx. So these structures are mostly contained in the head and the neck. The lower respiratory tract starts with the larynx or the voice box and continues into tubes, starting with relatively large diameter tubes, the trachea, and that branches continuously into smaller and smaller tubes within the lungs. So those include the relatively large tubes called the bronchi and the small tubes called the bronchioles. So in terms of structural organization, those are the main structures involved. Functional organization divides these structures into what function they're providing in the respiratory physiology. So the conducting zone, as I mentioned, those are passageways for air, basically, allowing air to move in or out. The respiratory zone is structures mostly about the alveoli involved in gas exchange. Many alveoli are clustered. Most alveoli are clustered into what are called alveolar sacs. But there are also scattered alveoli along tubes, including the alveolar duct and the respiratory bronchiole. So that's kind of our organization as we go through the anatomy in this video. All right, so let's start with the upper respiratory tract, and the main structures there are nasal cavity, sinuses, and pharynx. So they're color-coded on this slide, and we're talking about nasal cavity, and sinuses are surrounding that, and the pharynx shown on that slide. Right, so on this slide on the left is a mid-sagittal section looking at the lateral wall of the nasal cavity. And there are some features I want to point out that have to do with the function of the nasal cavity. Main function of the nasal cavity in the respiratory system is to warm and filter incoming air, and also to moisturize that air as it comes in. The nasal cavity in all segments of the respiratory tract are lined with a wet mucosal membrane, and so that membrane has a lot of mucus that's going to trap stuff coming in, and it also, being wet, is going to humidify or moisturize the air that comes in as well. In the nasal cavity, you have projections from facial bones that are into the space of the nasal cavity. Those are called the nasal conchae. So there's a superior, middle, and inferior nasal concha. And there are also channels between the conchae. So those are called nasal meatuses. Those are the main passageways for air as it progresses from the nostril to the pharynx. Okay, so these projections cause the air to swirl and maximize the contact of the incoming air with the mucosal membrane, and that's good for filtering and moisturizing the air. On the right side of this slide is a coronal section of a human cadaver showing the nasal cavity. You have a left and right nasal cavity, and the main separator between them is the nasal septum. So that's this structure. And you can also see the nasal conchae scrolling and projecting into the nasal cavity. Okay, associated with the nasal cavity are sinuses. They're called paranasal sinuses around the nasal cavity. Basically, these are chambers within surrounding facial bones, and they're lined with mucosal membranes. And so you can see from this slide, it's bilateral. They're on both left and right side. Chambers within the maxillary, sphenoid, ethmoid, and frontal bones. And all of these have a mucosal membrane that produce mucus and secrete that mucus through channels. And I think you can see the channels on the slide. And these channels are going to enter into the nasal cavity. Occasionally, these sinuses get inflamed, sinusitis, inflammation of the sinuses. And that could be due to an infection or to an allergic reaction. If the inflammation is severe enough, that can close off the passageway into the nasal cavity. And so it builds pressure due to accumulation of the mucus inside the sinus. Next segment is the pharynx. So the pharynx is basically your throat, and that's posterior to the nasal cavity, and it runs through the head and into the neck. The pharynx can be subdivided into three segments: nasopharynx, oropharynx, and laryngopharynx, from superior to inferior. And they're color-coded on this slide. Nasopharynx connects to the nasal cavity, oropharynx to the oral cavity, laryngopharynx to the larynx, the next segment. Now, the oropharynx and laryngopharynx are common pathways for both air coming into the respiratory system or out, and for food coming in for the digestive system. So these two segments, unlike the rest of the respiratory tract, because they're shared with the digestive tract, they have a different type of epithelium lining them, just due to the increased friction of food moving through them. We'll talk about that in a later video when we talk about the mucosal membrane. All right, this slide is showing some other structures associated with the pharynx, and those include the tonsils. In the roof of the nasal pharynx are the pharyngeal tonsils, and there are other tonsils elsewhere. Tonsils are basically lymphatic tissues, and they are involved in immune defense, and we'll talk about those in the immune system chapter. There's also a tube connecting the nasopharynx laterally to the ears. So this would be on both sides. So that's the eustachian tube, or on this slide it's labeled the auditory tube. Let's see. The next segment is the larynx. Main functions of the larynx are in producing sound. It's your voice box. Also, the larynx has an important function in channeling food when you swallow into the esophagus and not letting it go into the trachea and eventually into the lungs. The larynx, being made of cartilage, is very flexible, and the cartilage has an important function in maintaining an open airway. And those are the main functions of the larynx. The larynx has a number of pieces made up of hyaline cartilage, and I want to point out some of those on this slide and as we go forward. The largest piece is called the thyroid cartilage, kind of a shield-shaped cartilage from the anterior perspective. It comes to a point. That's the laryngeal prominence, otherwise known as Adam's apple. The thyroid cartilage moves up and down when you speak or when you swallow. And if you put your finger on your Adam's apple, you can feel that as you swallow or speak. Okay, there are muscles attached to that that are going to move that up. And that has an important function when we talk about swallowing, especially channeling food into the esophagus. The base of the larynx is made up of a cartilage called the cricoid cartilage. Cricoid cartilage encircles the entire larynx. Also, I want to point out the epiglottis, which can be seen from this anterior perspective as kind of poking up behind the hyoid bone. This in a mid-sagittal section through the larynx shows the epiglottis protruding upward. Basically, it has a core of flexible cartilage, elastic cartilage, covered by a mucous membrane. The importance of the epiglottis is when you swallow, the muscles attached to the thyroid cartilage pull it up. Sliding up of the thyroid cartilage allows the epiglottis to pivot, and the flap covers the entryway into the larynx. Just going back to the previous slide, pivoting of the epiglottis here covers this entryway into the larynx, and then food, the only pathway available, is down through the esophagus. Okay, one other piece of cartilage I want to point out is in the interior of the larynx, and that's the arytenoid cartilage. Basically a small L-shaped piece of cartilage. You have two of them, one on each side, and it's attached to a muscle called the arytenoid muscle on one side, and it's attached to these fibers, which are called the true vocal cords, on the other side. Now, if you look down into the throat, and this view is a superior view looking down into it, and you can do this with a tool called the laryngoscope. Looking down into the throat, we're looking at the rim of the epiglottis here, so that would be from this perspective, looking downward, we're looking at this rim. And this is looking at down into the larynx. This would be the air passageway. Here the passageway is open, here it's closed. So the arytenoid cartilage is attached to these white true vocal folds or vocal cords. And these true vocal cords are attached to a mucous membrane called the false vocal cords. So you can think about this as basically a curtain, and there are two sides to it. You can close the curtain. Here it is closed, and the airway is closed now. Air can't pass up or down through the larynx. Or you can open it, and now air can pass through. So how that happens is through the muscles acting on the arytenoid cartilage. This cartilage swivels, and if it swivels inward, that closes the pathway. If it swivels outward, that opens the pathway. By the way, the opening of the pathway is called the glottis. There it is. I was forgetting that one. That's the glottis. So you can open the glottis by muscular action on the arytenoid cartilage. Okay. Next segment in the respiratory tract, and now we're in the lower respiratory tract, is the trachea. So from the cricoid cartilage, that transitions into the trachea. Trachea is the largest airway. It's your windpipe that progresses from the inferior part of the neck down into the superior part of the mediastinum. And then it's going to branch into two main branches called the main bronchi, left and right main bronchi. Notice that the trachea is running alongside the esophagus, trachea anterior, esophagus posterior. The esophagus is a flexible tube that collapses on itself when you're not swallowing, when there's no food moving through it. We don't want that to happen for the trachea. We want the trachea to remain open. And so there's a key structural difference between those two tubes that allows the trachea to remain open. And if you look at a cross-section through the trachea, you can see that structure. So there are different layers of the wall of the trachea, but here's the key part I want to point out. This yellowish arc is hyaline cartilage. It's called the tracheal cartilage. And as you move down the trachea, you see there are regular intervals of tracheal cartilage along its length. Tracheal cartilage is made in a slab, and it's incorporated into this tube. It's flexible, but it wants to spread out into sort of its flat slab-like structure. And so being constrained in this C shape causes it to exert outward force, and that outward force is maintaining this open passageway through the trachea. So that's an important feature, obviously, of your airway, maintaining it in the open configuration. Another feature I want to point out is at the base of the trachea is a structure called the carina. The carina is, let's say something gets into your airway, it gets by your epiglottis, you choke on it, and what happens is it's going to pass into, depending on how big it is, let's say it's small enough to pass through your trachea, where is it going to contact first? It's going to bump into the carina. So the carina is loaded with sensory receptors. Anything making contact with the carina triggers the coughing reflex. Okay, as we progress through, then here's the cross-section trachea and esophagus. This is showing the different levels, layers of the trachea. So mucosal, innermost, submucosal, and this would be at a segment where there's a C-shaped cartilage ring. One other feature I want to point out is the tips of the C here are connected by a muscle called the trachealis muscle. So this muscle contracts when you cough, and what that does is bring these tips closer together, and that squeezes the lumen of the trachea. That allows you to generate more pressure due to movement of air when you cough. More pressure is better for getting rid of anything stuck in your trachea. Okay, this slide is about what's called the bronchial tree. So this is moving forward from the trachea, the tubes that branch off. And like a tree, if this is the trunk of the tree, it's kind of an upside down tree, basically. Trees branch and those branches branch, etc., etc., etc. That's true for the bronchial tree as well, but these are basically smaller and smaller tubes. Starting with the main bronchi, you have two main bronchi, one left, one right. And they're color-coded on this diagram on the side here. So the green are the two main bronchi. Branching off the main bronchi are lobar bronchi. They're color-coded blue here. You have three lobar bronchi in the right lung and two in the left lung. And the reason for that is there are three lobes in the right lung. It's larger than the left lung where there are only two. Okay, lobes are basically segments of the lung that are sectored off by connective tissue barriers. The lobar bronchi further divide into segmental bronchi, color-coded yellow on this slide. Within each lobe, there are sectored off segments. And then as we progress through, you get smaller and smaller bronchi, and those are indicated by the red. Those don't have names. There's probably, I think, 20 or 21 levels of branching as you go through. So with each branch, you get more branches, but they're smaller in diameter. Right? This slide shows progression through the bronchial tree, starting with the trachea, the main bronchi, the segmental bronchi, and lobar bronchi, forgot about those. Eventually you get to tubes that are small enough, and these are about 1 millimeter in diameter or less, and those are the bronchioles. This is still the conducting zone we're going through here, and then eventually we reach some alveoli attached to some tubes. So that's the beginning of the conducting zone. respiratory bronchial, alveolar duct, and the alveoli. Okay, that's the end of this video. And in other videos, we're going to pick up with what's the structure of the alveoli and the respiratory membrane.